Dr. Basaro is the head of the SI for the National HIV Program. The National HIV Program is actually the custodian of the parent of this platform, which is the Nigeria data ministry, which is being managed by the Secretary of Open to give funded at US government to the CDC. So the three panels I mentioned, APA, CDC, and our landlords, the Federal Ministry of Health, the NASCA, are the ones managing this platform. Like Chief has said, prior to COVID, the platform was like using the remote learning for our partners in the outreach parts of the country. Then we also a lot of shared knowledge, using travel, but with the advent of COVID, we became more priority. This was very important. And it's also very important in the sense that if you all know what happened during COVID, where people are affected after COVID also, because that was easier to subtract COVID. Our focus were very scared of what will happen to the because of that fear. There was this genuine fear there was going to be a performance of all of the people that managing economy. But with the use of innovation and technology, just something like the Eco platform, we were able to surmount that challenge and actually do activities. So I don't know if you have the rapporteurs here or online. Music joy. So, Dr. I don't know if you have any opening remarks before we continue.
So thank you, Dr. J. Thank you very much for this session. And as you know, this is a very important session for the government of Nigeria and our partners. And I'm happy I'm seeing Clark Wigley online. I'm happy I'm seeing Azuka, Prosper, and every other colleague. So for us, this is a very important session, and it focuses on the relevance of the SPICE Eco itself as a platform for information sharing and capacity building. The goal of the federal government, or the mandate, or the vision now, is that we should make this a standard dissemination tool for the entire country, looking at both research, HIV program, other health systems, and other development program. So for us, SPICE Eco is a system that we should all imbibe. And I would like to thank our partners, the PHIS 3 team, supported and funded by the CDC through the US government, for the progress we've made so far. And definitely I would thank the innovators, or maybe inventor, the starter of this project, Clark himself, for what he has been able to achieve. So that's our opening remark for now. And we may proceed straight to the schedule as lined out on the agenda. Thank you. Thank you. Sorry, I couldn't make it physically. I just came back to the country yesterday, and so I had to be in Abuja now to join virtually. Over. Thank you.
Right, welcome back. So, in that regard, I think we just moved to the agenda. We're calling on Prosper. I believe it's online to give us a brief introduction to the ECHO programs and SPICE.
Yeah, thank you very much, Dr. J. Nice to be here. My name is Prosper Onyekachukwu. Please, can you confirm if you can see my screen?
Yes, you can.
Okay, so it's just a brief introduction. We know I have about 5 minutes to do this, and we have another presentation on maintaining good mental health among healthcare workers. So I'm just going to go straight to the point to explain what we do on ECHO platform, and then basically also how NIMA community and the conference participant attendees can be able to join the session going forward. So ECHO basically is a digital platform for training and sharing medical knowledge. It started in New Mexico in 2003, where the founder, Dr. Sanjeev, had to go to Mars just to attend to patients. And then that was when it was a case of hepatitis, where the patient has to travel for very different hours just to, get some medical attention. And that continued after some time before he now thought of, instead of having people to travel this far, why not build the capacities of health workers to be able to do the same thing he is doing in the city of New Mexico? That was how he came about the concept of ECHO, to build capacities of health workers, to move knowledge instead of moving individuals, to be able to democratize medical knowledge, and then have the people at the underserved community do the same thing that he's able to do. And that's how ECHO came about. And what's the full meaning of ECHO? ECHO is simply extension for community health outcome, which is used where distance is a barrier to provide mentorship. The project, like I said, was launched by the University of New Mexico in 2003 by Dr. Sanjeev Arora. And the aim is to democratize medical knowledge and get best practices for underserved communities all over the world by moving knowledge instead of moving people. ECHO uses internet-based video conferencing technology to create linkage between healthcare workers at the facility, which is the spokes, and then subject matter experts based at central centers of excellence, which is like the hub. So the subject matter experts are in their comfort zone in a hub or in anywhere around the world, speaking to the healthcare workers that are the spokes. In the station in Nigeria, it is the facilities that are scattered all over the country. For us in Nigeria, every Thursday we do have ECHO, whereby the SME are seated in one part of the country, connected, and then speaking to healthcare workers on different health issues. Basically, for us, following the directions of the Federal Ministry of Health, is to provide care, treatment, and management of HIV and AIDS in Nigeria. ECHO has helped us as a country to improve health security, reaching HIV epidemic control, and curbing vaccine-preventable diseases through continued capacity building and sharing of new knowledge during each ECHO session. SPICE ECHO means, I know most of us have been asking what is SPICE. It simply means sustaining positive impact for the control of epidemics in Nigeria. This was rechristened from PACE ECHO, which is Partnership for Achieving Control of Epidemics, to SPICE ECHO in May 2022 by the Federal Ministry of Health, just to give a further, expand the program, give it a robust platform so that we can accommodate other areas beyond HIV and AIDS. And since then, ECHO has continued to expand far and wide, and even beyond HIV to non-communicable diseases. We now feature monkeypox, feature communicable disease, among other disease areas of public health importance. The Federal Ministry of Health is using the SPICE ECHO to build the capacity of healthcare workers to provide better care, treatment, and management of HIV, and sharing global best practices among healthcare professionals. Looking at the key objectives, of course, there are a lot of objectives, but looking at some of them is to identify initiatives to achieve epidemic control via weekly engagement of healthcare workers. Also, one of the objectives is to leverage scarce human and material resources for health, and then to share best practices to reduce disparities across health facilities. From ECHO, you understand that you don't need to travel to see the best of professors We have had professors in Lagos, in Aminu Kano Christian, in Aminu Kano Teaching Hospital, among other institutions of learning, stay in their comfort zone and disseminate knowledge. ECHO also encourage case-based learning across facilities to master complexity. One of the things that the new innovation that we have brought to bear since Phase 3 took over was to establish the case-based presentation, which gives facility the opportunity to present cases as they have managed successfully in their facility, or those that they are about to manage, or those that they don't know how to go about it, and they could come on ECHO platform. In fact, we do that every last Thursday of the month. We have facility to present. That gives the facility the opportunity to give back to us what they have learned and all. Now, looking at numbers and participating states, ECHO is currently active in the 19 supported CDC states already showing on the screen. And as of today, we have over 690 facilities connected on ECHO platform, and we reach out to these facilities every Thursday, 10 a.m. And it goes beyond this, because these are the numbers we know, but some of these facilities share the links with their friends and their loved one, and they all join to learn. Now, I have to be very fast to be able to give room for presentation. Now, how participants can join, which is the main reason why we are doing this, because according to Dr. Chika, he felt that what we are doing on ECHO needs to go beyond our current coverage to other health communities. So how can NIMA community and the conference attendees join the session? Participants are expected to join in a group from their facilities where ECHO equipment has been set up. So the practice is that all the supported health facilities scattered across 19 supported CDC states have ECHO infrastructure, TV, mic, and other things that they will sit in a didactic session to learn. And on every Thursday, these individuals join to learn. Then aside those are the facility that joins the call, we also have individuals from implementing partners and other healthcare workers. They can also join using their smartphones, using their iPad, using their Android, and the rest of them to learn. And then we have the subject matters experts, which in this case are the presenters, the profs, the healthcare managers, the ALT coordinators in a session whereby they have to present for their facility. And then we have the panelists also who join from their various locations. So these panelists are, when we have facility case presentation, that facility will have to showcase what it is they are doing in their facility. So we usually engage panelists like professors in those areas based on what the facility that are presenting. Take, for instance, maybe management of treatment failure or any other program area. We engage an expert in those areas, and they are the panelists that after the facility finish presenting, the panelists will guide them, give them correction, know where they did not do well, put them through, and the next time, this is what you need to do, and all of that. And then the session happens every Thursday by 10 a.m. in the morning, and showing on the screen is the link to join for the NIMA and all the conference attendees. So I've just been prompted about the time. So thank you very much. I will just sit back. After the SME presentation, I would be able to take questions. Thank you very much, and over.
Thank you, Prosper. Yes, can we give you a round of applause? Okay, so I think to demonstrate what we have just told us, we'll be calling on the subject matter experts to give us the talk, like what usually happens to people day. And because of the quality accounting from the rest of the Nigerian, we should be talking on maintaining good mental health. So
Good afternoon to all conference attendees. I hope you are having a wonderful conference experience. So like he rightly said, I'm Dr. Akani Yetunde, and I hope I'm audible enough.
Yes, you are, please.
Okay, so I'm supposed to be talking briefly about the mental health of healthcare providers. And I think it's an essential, okay, sorry, I need to share my screen. Sorry, I think, let me share my screen. Sorry, I think, sorry, please. I need to log out to share the screen. Okay. Okay. Okay, so just give me some minutes. Okay. Are you seeing the screen now? Hello? Can you see my screen?
Yes, Dr.
Yes,
Akani, we
yes.
can see your screen.
We can see your screen.
Okay, so thank you very much for putting me on the call. Like Prosper rightly said, by helping us to understand the importance of Spice Echo. So I'm supposed to be talking about mental health as a healthcare service provider, which is an essential part of what we need to talk about. Is now becoming a global concern, considering the importance of mental health as it relates to us as healthcare service providers. And so I just want to give an introduction. We need to understand that mental health is the mental health of healthcare workers is a major public health concern and threat to quality of care delivery. But so let's quickly intimate us about what the definition of mental health is. Mental health is a person's condition with regards to their psychological and emotional well-being. And that is to say that our mental health influences the way that we function from day to day. And so it is very essential that it is being taken care of. Otherwise, it's going to affect what we do and how we do what we do. So as healthcare professionals, we are exposed to multiple of stress factors within our work, which may influence our physical, mental, and emotional well-being in a negative way. Mind you, I've just told you that what mental health is. That has to do with our psychological and emotional well-being. So once it is affected, it's going to affect what we do because our mental health influences the way we function in a day-to-day activity. And then we also need to quickly understand what this mental illness is. It says that it's just a physical illness of the brain that causes disturbance in the thinking, behavior, energy, or emotions that makes it difficult to cope with the ordinary demands. So you could see what the definition of mental illness is and what the mental health is. So as health service care provider, we need a top notch of good mental health for us to be able to function effectively. So there are definitions of terms here. What is work stress? Work stress refers to the harmful physical and emotional effects when job requirements do not match workers' resources or needs. Work stress can lead to poor mental and physical health. Remember, we said that mental health is a person's condition with regards to their psychological and emotional well-being. And so the stress we face can actually serve as a trigger or affect our mental health. So mental health includes a person's psychological, emotional, and social well-being and affects how we feel, think, and act. And so if our thinking, our feelings, our actions are affected, then it's going to affect the service, the quality of service we'll be delivering to our clients. And that's why it is essential for us as health service provider to be able to have a balanced mental health for us to do well in our service provision. So what are the things that can actually bring about some of these mental health problems for us as healthcare workers. What triggers this? We said intense, stressful, and emotional situation in caring for those who are sick. It depends on the service provision. It depends on your area of specialty. For you as researchers, I know that a lot too is placed on you. You have a lot of demand to ensure that things are done well, to ensure that you find solutions to health issues, health problems. So some of these situations can be very stressful for us. It exposes exposure to human suffering and death for those who work constantly with those who are ill, who die often, who face death issues. Then unique pressures from relationship with the patient, family members, and employers. We also have some working conditions that are very, very hazardous. Exposes us so much, like during the case of COVID, you and I will agree with me that we lost so many healthcare service providers to the COVID as a result of the exposures that they had. And so these are mental health issues for us because it affected a lot of service providers. And as a result of that, some of our patients were not even given the kind of services they demanded because of fear of dying, even as service providers. Then we have other infectious diseases and hazardous drugs that people are exposed to in the course of their work, and demanding physical work and risk of injury, such as from handling patients. We also have issues of long and often unpredicted schedules of hours of work. This often related to as-needed scheduling, unexpected double shifts, and unpredictable intensity of on or call work. We have too much work because currently there's a brain drain of medical providers, and you know what that means for those who are left behind. So these are issues that can actually affect our mental health. And then for many health workers, unstable and unpredictable work lives and financial strain. People do so much and then they are paid so little. So what you are paid is not commensurate to what you do. And that actually affects you because we also know that finance actually triggers our mental health when you cannot actually provide for your needs or the needs of your loved ones, and then coupled with the fact that you need to offer services to those who are in need. So these are issues that can actually trigger us. We have long shifts, lack of physical or psychological safety, chronic of care, moral conflicts, where at times you feel guilty over the death or the outcome, negative outcome of some health issues. You feel that maybe if you had done better than this wouldn't have been the problems. And so these are issues that can actually affect our mental. Then jobs insecurity is a major problem. There are people who are working in places where they're not sure of the next minute. What happens? They attack on them. So these are issues that actually can affect us and affect our mental health. Then workplace-related bullying and lack of social support. So what are the effects of work stress on mental health? It brings about burnout, and once you are burnout, then you can offer little or nothing. And then it's not just that, it affects your own physical health. And that's one thing we need to realize, that once our physical health is being affected, then it's going to affect every other thing we do. So it brings about depression for us. People no longer enjoy what they do, cause anxiety, cause a lot of sleeping disorder and other illnesses that you and I would agree that healthcare workers are currently going through. Then it also affects our level of professionalism. The truth is that when our mental health is compromised, it also helps us to compromise the standard of care. That's just the truth. It affects what we do at any given time. And then, like I said, the quality of service is also affected, the efficiency, and then overall quality of life of both the service provider and the client the patient is affected. So it is critical to identify and mitigate these work-related risk factors to protect the mental health and well-being of healthcare workers. So what can we actually do? The best, one of the most effective strategy to overcome threats to mental health of healthcare workers is effective self-care practices. Effective self-care practice means that you have a good level of self-awareness. And what that means is that You know when you need help. You know when you need to stop. You know when you need to refer. We'll also talk about self-compassion. You should know when you need some level of concern, level of care from other people. You should be compassionate on yourself. In as much as a service provider, we feel compassionate on our patients that will provide services to. You too should be compassionate about yourself. When you are compassionate about yourself and what you do, it will help you to become more efficient, because you realize it when you know that you know your limits, and then you know when you actually need help. Because when our mental health is not stable, it's obvious. People can see it, and then we as well can feel it, because we have some signs that will start saying. So showing compassion to yourself means seeking for help when you need help. The practice of altruism, the implementation of a variety of strategies such as physical, social, and inner self-care domains. We talk about physical, getting exercise, social. We talk about having good moments with people who can increase your feelings of being loved, be around people who understand you, sit out, experience some gatherings, social gatherings that can actually help you. These are very important. So practicing self-care is important for us as healthcare workers, especially during times of crisis, uncertainty, and higher demands. This can also be done by frequently checking in with and being aware of one's emotional level and stress level. That's what I said. We need to understand how we can handle issues. Know your limits. We have circle of control. Anything that is outside your circle of control, it means you cannot control it. And so it's either you seek for help, or you allow it to be until when issues can be resolved. And so it is important to be able to balance your emotional level at all time and stress level. So you should be able to identify signs of stress in you as a healthcare provider. When you start feeling funny, you start feeling unusual, you feel sick, when you know that, okay, medically you're supposed to be fit. We have signs like headache, malaise, fatigue, unnecessary pains over the waist, just feeling unhappy with yourself and people around you. Taking breaks whenever it's possible, it's very, very necessary. There are some of us who don't want to go on leave because we feel that when we go, certain things will pass us, some opportunities will pass us. No, there's nobody that is indispensable. We need to understand that the body needs rest. And so if you don't come to terms with the fact that you need to understand your body system. And once you understand your body system will also understand you. Practicing healthy daily routines like eating healthy food, exercising, or taking walks in nature is very, very important, and getting enough sleep. Some of us work till 2 a.m., 3 a.m., and then you're expected to start the next day as early as 8 a.m. And so you are denying your body what it needs to function well. And then when there's a total breakdown, it's going to affect your mental health. And so allowing emotional processing whenever possible and through the means preferred. So we as healthcare workers, we need to understand that well-being of others, we place the well-being of others. We are very important, we are very particular about the well-being of others. And at times we place them before ours. But then it's important for us to know that we need to place our well-being first, because it is only when you are well, when you are mentally stable, that you can assist the people who are unstable mentally. And so if you do not have a good mental state, then you might not be able to offer anything good. Remember, we said that your mental health influences the way that you function from day to day. And then if it is not properly taken care of, it's going to affect all that you do. It will be a great challenge to the work you do. So however, it is important for us to prevent anything that will affect our mental health. Thank you very much.
Yes, thank you, Dr. Mohammed. Can you please read out the resemblance round of applause? Yeah, so we are going to the next, which is we are completing some questions. And I will say that the question should be around the able platform platform or if you have a lot of the as well. So you are present in the audience or online. No takers. Thank you very much. So that means you all don't one of what I don't know and share with us. But more importantly, I hope you all know how to develop the platform for future. All I can do.
I don't know if I can respond. I have a question on the chat box. I'm not sure I saw that chat well, but then I think somebody was saying, why must we be on calls? Why must we be on calls? Why must we be on calls after regular work hours? Can you help make all these mental health tips pictorial? Too many worded information, useful information, okay? I don't need to explain why I have so many worded slides, but I'm sorry about that. That's not our pattern of presentation on ECHO. We try as much as possible to use a lot of pictorials because we know that that's the best way to actually teach people and to retain information. But then this was just impromptu, and so I had to do this. So there are a lot of questions here, and if you look at them, they are actually professional, has to do with your employer, employee, and work policies and other things. And so that's why we are trying to also engage employers of labor. It's important. We are trying to engage employers of labor to understand that there's a limit to what their workers can do. And that's very, very necessary. And then, you know, at times, when you are called upon, you can't turn down these calls because you and I know that our remuneration is tied to that. But like I said, it's a two-way thing. It's not just about the employee, because the employer needs to understand that there's a right, there's a limit to what the employee can do. And so those are the things. So it's not just about you, the employee, it also includes the employer. And so that's why we need to actually have forums to engage employers, organizations, for them to understand that the mental health of their staff will be at stake if the needs of the employees are not taken into consideration. I tell you that we might be thinking that we'll be able to give, we'll be able to deliver more, we'll become more efficient, but you discover that at some point in time, provision of service will start dropping and the quality of service we'll get will be lower. But then one thing we also need to know as service provider is that when there's pressure on us as service provider, it affects the quality of service that we give to our clients, our patients. And so what that means is that it's the patient who suffers the most because they are not being attended to the extent they are supposed to be attended to. So some of these issues are not something that an employee can really take care of, understand.
Are you still with us?
So, Dr. J, while we're waiting.
I think she's gone.
Okay, so let me just add to what she said. So thank you very much. Being on call is a professional requirement. Being on calls is a professional requirement. And I remember very well when I was, of course, much younger doing that calls. I used to do calls from Thursday to Monday, non-stop then. And it was a lot of stress. But what I opted for them, what I told the employer then was that after your call on a Monday, you should have at least a full day off, which I think the nurses do. They go on offs to recoup some of their energies after night duties. So for us, it's a professional calling and we've been trained to do that. But if you have facilities and other requirements in the system, of course, the stress will be less. Now, looking at what Dr. Akoni lectured today, she spoke of mental health. It has so many dimensions. We should also consider interpersonal relationships and your relationship with your office management, how you work with your colleagues. It also affects your mental health. So we should not look at it from the point of view of call you're overworked alone. It has to look at the entire package of the existence, family balancing, social balancing, office balancing, interpersonal relationships. And at the end of the day, you should live a healthy life in terms of your delivery and efficiency. Co-chair, that is my addition to that.
Yeah, thank you for the introduction for giving us insight to that. We can never reach work-life balance. We can never say one like one. All of us have to work and work and work and work. You always like to always go out of balance work because work continues. And work is tough, but life is continuing. And lot of people, anyone wants to drop today, we want to start, we continue to follow, or that right that moment, because life goes on. But it is very, very important that as we do our work, try to better our best. Let's make sure that we balance our lives. That's why in most organizations, you have what we call HR. HR is not just afterward resource management, it's not just about employment. Is one of the pure core things of the HR is to ensure that there's work-life balance. You know, I told you of somebody who was having, let's say, for instance, maybe was giving a class to people in the office together. And when years that you really have to whatever because I was having issue with my wife, we called overnight, I always now in the office, I can't even concentrate. That would be an escape from being punished for not making that would be. But what if HR manager said, you don't want to see me and to arrange a counseling session for you to help you deal with this because if you don't settle that, you will be able to work. It's not just about what happened the night before. So it's very, very important for us to maintain our life at home because it affects the work that we do. And the work we do also affects our life at home. So Dr. thank you very much. I'm just going to hand over to my co-chair to give his remarks before we close the session.
Thank you, Dr. JOC Samuel. So thank you once again for chairing the session physically. And for us, this is a very, very informative session. Like Dr. Akoni mentioned, she tried to wrap up or to summarize a lot of things with few slides in less than 20 minutes. Usually, the echo session gives you 45 minutes. The actual echo session we do every Thursday gives you 45 minutes for the teaching and about 15 minutes for the discussion. And there are times that we can extend 1 hour 30 minutes based on the importance and the richness of the discussion. So this is just a sample of what we do. And I must appreciate Dr. Chika and the NIMA team for putting this together. For us, is a success story which we must continue to support, we must continue to guide and protect in such a way that it can give us even more expanded use and coverage. So for us, like we said, this is just a sample of what we do. Dr. Akoni give us a sample. So she has a lot of topics on similar things on personal relationship, on counseling, and other things on research, on viral load, on surveillance, epidemiology, and every other area. So for us, please join us every Thursday, 10 a.m. and the link has been shared. Thank you once again to the organizers and have a good evening. Over to Dr. J. Dr. J. Let me invite Prosper. Prosper, are you there?
Yes, I'm here.
So it's Dr. I can't get Dr. J again, so I think we can close the session. Once again, let's thank Dr. Chika very well for this organizing this. So close the meeting.
All right, thank you very much. And just an addendum to what Dr. Bash said. I will be sharing the link to all the NIMA attendees and the NIMA community. We have up to 1,000 license to accommodate everybody. So from next week, Thursday, expect the ECHO invites and we expect you to join. And then also to other participants that have sent in their email to me. So thank you very much. And bye for now. We look forward to seeing you again tomorrow on Thursday when we are having another ECHO session. Bye. Bye, Clark.